Is Deputy Seán Crowe to the Minister for Health to discuss the lack of provision for respite care and home care packages. Deputy Seán Crowe has 4 minutes.
Good morning, Minister. I requested this topical issue because I'm hugely concerned about the lack of provision being provided by the Department of Health. I realise it's not your department, but for respite care and home packages. I'll just give an example of this, and just particularly how it came to a head. But there's a 93-year-old constituent of mine residing, who was residing in hospital after recent illness. The social worker felt that 21 hours would be awarded to this family. The difficulty is that the family have been told that there's no funding available for the 21 hours. So I have put questions down to the Minister. The Minister is saying that it's a matter for the HSE, but the HSE are not in a position to actually give the information in relation to this 21 hours. Now, I realise that it's an issue that's affecting people right across the state. I think for instance, in some counties have been absolutely left behind. Nearly 700 people waiting in Galway, 700 people waiting in Galway, over 600 in Dublin North, 578 in Wexford, and the 200 people waiting in Dublin South West. They're all individuals, they're all impacted by it. But I suppose the crisis this family has taken is that the mother was getting very, very distressed where she was, and now they've taken her home. She's getting 24-hour care. You can realise the cost that's just added up in your own head. It could be anyone's relation. This is just one example, but unfortunately the family have taken on this burden. But surely if there's indicated that there's hours available, that the family should be getting some support. But unfortunately, up to now, that hasn't happened. So I know it's not your responsibility, Minister, in your particular area, but there is a thing called collective responsibility, and I'm asking you to maybe go back after this debate, go back to the Minister in charge, and to try and find out when this actual funding is available. You might recall during the week I asked the Taoiseach again about this particular area. No one on the Cabinet level seemed to be able to answer the question in relation to these hours. He's saying that the budget has been increased for next year, and that's great. But when will this actually be seen on the ground, and particularly in these homes? For me, it doesn't make sense. It doesn't make any economic sense for leaving people in beds or respite care if family wants to take someone home. It's distressing for the patient itself. It also probably puts the patient at risk, because there's other infections, there's other things that can get in hospitals, and unfortunately that's so. This woman, and I suppose many other people who are elderly, want to spend the remaining time in their home. That's where that the happy memories are. They don't want to be in a bed in a ward with strangers, with people who are looking after them and looking after them well. But at the end of the day, she wants to be home with those who love her around her. She's good neighbours and so on. But people that age, surely to God, we should be able to come up with some sort of package or some sort of supports to help people like that remain in their home. I don't know how you feel about it. Privately, I'm just, personally, I just feel sickened to the stomach that someone would be left in this situation, that the family are left helpless. The woman, as I say, really in her medical condition, she's on oxygen, she's blind. Her brain is absolutely perfect. She knows exactly what's going on. She knows her own mind. She wants to stay in her home. And surely, with all, we're not a third world country. Surely with all the wealth that's floating around, the money that we can spend and misuse on different things, that surely we could come up with some sort of supports for families like this one.
Thank you, Deputy Crowe. I'm taking this on behalf of my colleague, Minister Daly. I certainly, in line in the case that you outlined, the 21 hours home help that's required, you couldn't but wish to see that a person in that situation, and you outlined someone who's of that age but still has her faculties, would very much want to be in her family situation. The government's core stated objective is to promote care in the community so that people can continue to live with confidence, security and dignity in their own homes and communities for as long as possible. A wide range of services are provided, including home supports, daycare and residential care, through direct service provision and through voluntary and private providers. Respite care is an essential component to ensure older people with care needs in the home, including those with dementia, can be cared for in their community and close to their carers. The service offers additional assistance to families and carers, thus helping to alleviate the ongoing stress associated with providing care. Respite can often assist with avoidable acute hospital admissions. Respite is provided in several different ways and settings across the health system, provided through designated respite beds in public residential centres and contracted by the HSE and private nursing homes, where it is used to increase the availability of such beds to meet demand within the resources available in the local area. There are over 1,800 short-stay beds in public long-stay units. These may be used interchangeably for respite, rehab, convalescence or other uses, depending on current demand in the centres. Therefore, the number of respite beds in any one month can fluctuate up and down depending on demand for that bed. Planned respite can be provided, allowing carers to have planned breaks throughout the year. Respite may be provided as part of an enhanced home support package, where the funding can be used to procure a period of respite. Respite can also be provided on an emergency basis for unforeseen circumstances due to bereavement or illness of the carer or emergency environmental changes to the residence of the client. The provision of respite beds is part of an integrated model of care, and the HSE strongly advocates and supports the system of respite care nationally. HSE is currently considering the role of the respite services and how these can contribute to the provision of a streamlined pathway of care for older persons. Respite services are also an important part of the range of services supporting people with disabilities and their families. Short breaks can also provide an opportunity for individuals to socially meet and engage with other people. This year the HSE will provide over 182,500 respite nights and 32,500 day respite sessions. Home care is an increasingly important part of the supports for enabling older people to remain in their own homes for as long as possible and for facilitating their discharge from acute hospitals. Last year, a single funding stream for home support services brought together the funding for home help and standard home care packages, which now operate as a single home support service. Over 52,000 people will receive more than 18 million home support hours this year. This will assist older people to live independently in their own homes and will enable large numbers of people to return home following acute hospital admission. Despite this significant level of service provision, demand continues to rise and there is considerable variation in access in different parts of the country. While the existing home support service is delivering crucial support to many people, it needs to be improved to better meet the changing needs of our citizens. That's why we propose to establish a statutory scheme for home support services which will improve access to the service on an affordable and sustainable basis, while also introducing a scheme of regulation that will ensure public confidence.
Seán Crowe, 2 further minutes.
Again, Minister, I realise that you're in this position that you're reading the script, but just on a personal note, what do you say to families that are left in this situation, who have clearly, there's a crisis facing this family? I don't know of any family that would be able to pay, what is it, something like 20 euros plus an hour, 24 hours a day, 7 days a week, this package to allow this woman to stay in her home. It's a huge burden being put on it. We're a bit light in relation to response in families in relation in that situation. So I suppose, one, is there anything can be done if there is additional funding going to be made to the CEO area that this woman is located in, COAH7? Could it be? I don't know if you have in your script there, but first of all, if I had that information, when this funding will be released. The Taoiseach, as I said, during the week said that there was additional funding coming down the line. That would be one help, but I think we need to look at the bigger picture of, if we're serious about our population getting older, serious about supporting people that are clearly going to have needs and need support, and if our overall policy is to try and keep people in their home as long as possible, well, we clearly need support. This family are in crisis. There's no real answers for them here today. I'm waiting a reply from the Minister, but the Minister will kick it back to the HSE, and the HSE don't have the answers. And I know this sounds like a whinge, but I really don't know where to go with this. And the family themselves have come to me thinking that I have the answers. I'm coming in here today, Minister, asking you, have you any answers? And clearly we don't collectively. So if there's anything at all, you know, I know you're going to go back to the Minister, if there's anything at all, specifically for those who are really, you know, getting on in age, but want to drastically, you know, they're really distressed at the idea of having to stay in hospital, and there's a loving family that wants to take them home, but they need some sort of support. And if we can do that, I think that'll be a day's work, you know, a good day's work for us here today, if we can come up with some sort of solutions for the families like this. Thank you. And I'm just concentrating on one family, but I realise there's probably hundreds of thousands of families in the same situation.
Certainly many families, and this is no consolation, but I'm in my CHO area. I deal myself with similar issues, and it's down to resources, I suppose, in different areas. The bigger picture issue that you raised, the Department, as I said, is engaged in the process of setting up a statutory standalone scheme along the lines I would expect of the fair deal that exists for residential nursing home care, which can be slow to be accessed at certain times, but actually seems to deliver for the people concerned. And I think in this whole area of home care and home support, and the fact that we have many more people seeking it, and we know demographically have many more people seeking it, I think it makes sense to have a statutory scheme. I'll ask the Minister specifically about when he thinks that those measures for that scheme will be announced in the bigger picture. I will also ask him specifically in relation to CHO7 and the case that you mentioned. I'm sure, as you said, you're waiting on a response for him. But you know, if something can specifically be done in that particular case. But the bigger picture is that we are going to have a statutory scheme, but we should have it as soon as possible. I fully agree with you on that.
Thank you.